My name is Mustafa Rfat. I'm 35 years old and I'm currently living in St. Louis, Missouri. I am originally from Iraq, from northern part of Iraq. I am ethnically Turkmen. So in Iraq, as you may know, like we don't have advanced healthcare. So, and I have a rare illness. So it took me a very long time to get a diagnosis, multiple doctor visits, and had to travel many cities. And in fact, after so many years, I had to travel outside of Iraq to get a diagnosis. Um, and so with my illness, it was really difficult because my illness was progressing and getting worse while I was searching for a doctor who can diagnose me. Um, yeah, and then as you may know, even when you get a diagnosis, it's not the end. Actually, that's the beginning. So for me, since I had to go back to Iraq, where we didn't have the proper medications, we didn't have like proper medical services. So it was really difficult to deal with my illness and make sure it's not getting worse. Um, and, it brought a lot of, anxiety, like, worry about the future. And I was very young at that time. During my refugee time, I also did not have access to proper healthcare. So that was the time really my illness was getting really worse. And so when I got here to the US, they had to do everything from zero because I didn't have my medical records. Um, I only knew what type of diagnosis I have. So they basically started everything from zero, and they confirmed that um, I have the same illness. Um, but yeah, it took them a long time because here they also wanted to make sure, I have the the same disease. So and during that time, I remember it was very painful. I wanted to get some medication, but the doctors were wanting to make sure I have the same illness. One of the most difficult thing with my illness is it's very unpredictable. So it changes day by day, week by week, month by month. So that's what really makes it so difficult to live with. Um, However, with that, humans are so resilient. So you come up with your own strategy to prepare for this unpredictability and try to manage your life. So for me, it really, so I have physical disabilities. It limits a lot of things that I like to do, but unfortunately I can't. I mean, one of the main things, so I'm married, I have a daughter, and my daughter always asks me to like carry her, and I can't carry like heavy weights. So that is the main thing that really impacts me. I mean, I would love to, carry her, like lift her, but it's difficult for me. I had to start my bachelor's from the beginning because they did not accept my previous diploma. Um, but it was also a tough transition because I had to learn the language from the beginning, get to know the culture, get to know the system. And on top of that, I attended West Virginia University, and Morgantown, West Virginia is very steep. It's very like hill-like. So um, trying to walk these steep roads was very, very difficult. I came to a point when I got sick, I was like, I can't go back to school. You know, this is just too difficult for me. I can't carry my books. I can't carry my, um, you know, notebooks and other things. So, and my professor came up with a simple idea. She told me like I can buy a backpack that has wheels and I just can carry it with me. And she also told me about disability organizations. And I went there, they came up with a brilliant idea. They told me, well, yeah, they borrowed me an iPad and they download all my books on the iPad and I was using the iPad as a notebook. So basically, I had only a small iPad that I was carrying around the campus. So that was a, you know, that was a life saving for me. And you know, when I came to the U.S., I immediately picked up a new identity, which was a refugee identity, and also an identity through my religion. You know, I am a Muslim. I picked, you know, and disability became like a mainstream. So people talk a lot about disabilities that we didn't talk back in Iraq. So um, trying to navigate within these identities was, you know, was really difficult. Um, you know, like trying to like apply for a job, you know, when people ask you like, do you speak English? And you, I mean, obviously in my, when I first came here, I couldn't speak English and they know I have disabilities. So, and this is kind of like, I was like, you know, I had like double disadvantaged, you know, when trying to find an employment or try to, even when I, you know, try to apply for, when I applied for school, I remember I applied for a scholarship, and in that scholarship, they asked me to do like a simple test, but the test was designed for people who've been in the US and they went to high school here, they are familiar with the culture. And I remember, you know, walking away from that test thinking that, oh my God, like there were a lot of questions that I could have answered if I lived here, if I went to high school here. So I asked my friend to give me a word in science or like something that you get to expose if you go to college. And I went after 10 days to the caseworker and I told her, before you tell me the result, I knew I failed, but I want to help you understand my situation. You know, I am a refugee. I am new here. I don't speak very good English, and I didn't go to high school here. So, but if the test was in Arabic and Turkish, I would have passed it. And so I gave her a word and I told her like, so I told her, I'm going to test you. And if you pass my test, I don't need any scholarship. I don't need anything from you. But if you fail my test, you need to give me a chance to prove to you I can go to school. I can, you know, learn. So, you know, I gave her a word and I told her, can you like spell it for me? Do you know the meaning? I mean, you were exposed to this word. You went to college, you have a master's degree, you speak English. So the caseworker couldn't spell the word, couldn't tell me the meaning. And I was like, look, you know, you were exposed to it and you couldn't pass it. Like, what about me, who I never exposed to the questions, to the knowledge that you asked me? So, I mean, they understood my situation and they told me, well, we'll give you a scholarship for one semester if you pass it. will continue given the scholarship to you. I got, 3.6 in my first semester, and I passed it. I finished my bachelor's with an honor. But you can see, like, being a refugee and having a disability, it's 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 kind of like double disadvantage to you. I think first of all, like, making sure you give the respect, you be patient, you be supportive. I remember I had my first doctor, no, my second doctor. I never forget, he was treating me as a human, like he was able to see beyond my illness, asking questions about my life, about my family. I think, like, asking yourself, how accessible is my services to all the people, and is do we have like an interpreter? Do we have like um, are we aware of the cultures that are people have in our communities, and at the same time, like, people in general have a lot of stigma, have a lot of negative thoughts about people with disabilities and refugees. And if you are a refugee with disabilities, you're more likely to experience a lot of discrimination. Um, so just to make sure, like, you are questioning yourself, you are questioning your services, you are questioning the policies you have, um, and you are, able to reach out to invisible populations like refugees with disabilities, because it's just hard for someone who came to the US, who doesn't know the language, who doesn't know the system, to voice their concerns. So it's the responsibilities of programs to make sure they reach out to refugee services. They ask the question, what type of patients, what type of clients you have, how we can make sure we provide services to these people. I would say no. um, as I mentioned, providers don't usually see refugees with disabilities, and they don't have prior experience to help them. So, I mean, as I mentioned, I had um, a lot of positive experience, a lot of negative experience as well. Um, and I remember I did in my internship, um, I did a community outreach to assist the service providers' knowledge about refugees with disabilities. And unfortunately, the majority of service providers that I invited and during that seminar, they reported they don't have any experience working and helping refugees, especially refugees with disabilities. So, and that means you're not able to provide like good quality of services. So, which means like we really need to include information about refugees, especially refugees with disabilities, when we are doing um, like ground round or like other educational trainings. I would say there's a lot of barriers from multiple places. So, for example, back in Iraq, we don't have, you know, like any services for mental health. So for someone coming here, first of all, it's hard for them to imagine there are services for mental health. That's the first thing. The second thing is really trying to understand, depression, trying to understand anxiety. Like these are all, even though that person is experiencing it, but putting it in a word is just very difficult. So there's a lot of barriers from the patient side, from the provider side, and there is not many cultural mediator. My transition was very, very difficult, and I remember, like, within the first 2 months when I arrived here, I had to access mental health services, and that was a big life-saving for me, because then I was able to uh, get to know, like, there is services for mental health. There are, like, safe people, I can talk with. They will not share the information that I'm sharing with. And I think the refugee agency at that time, like, letting me know about mental health services early on was very helpful. And I also had, I didn't have just a regular interpreter, I had a cultural mediator. My interpreter was from Iraq, like, who understood my situation, who was able to translate things for me. I mean, yes, hospitals are obligated to provide you with an interpreter, but that interpreter, like, for example, I'm from Iraq. That person might be from, I don't know, Lebanon. And in my case, I am Iraqi Turkmen. So my language, my culture is very different than people who speak Arabic. So I'm kind of like, trying to understand Arabic, and then through that, trying to understand someone who is speaking different Arabic, accent, and using different words. So you can see through the interpretation, there's a lot of words getting missed, and you might not end up feeling like the services you are getting is beneficial. Before you arrive to the resettlement country, like in my case, to the US, like, you get to get, like, some training, which is called, I think, cultural training. And I think in these cultural training, they talk about employment opportunities, education opportunities, and how you can, resettle, to help you smoothly resettle. However, I think, so there is no information about disabilities. There is no, like, they don't tell you, if you, like, if you are disabled, how you are going to navigate the systems. So, I mean, mental health is a big, big problem for refugees in general. I mean, um, experience a lot of traumas. Um, they don't choose to leave their country. They are forced to leave their country. So it's very, very tough. Like, when I left Iraq, I got a new job, I had my car, I had everything, but I had to leave them within days. And when you get to resettle in a third country, you are starting everything from zero. And that's also traumatic. That's also a big cultural shift. The stigma is very, very big, when it comes to mental health among refugees. I think there's a lot that we talk about mental health in when it comes to refugees. And that's a good thing. That's not a bad thing. But I really think we also need to shift to talk about education, to talk about employment, to talk about um, other like things that you need to establish yourself in a country. You know, workers, providers at refugee services don't have the skills and knowledge most of the time to help refugees with disabilities access services. On the opposite side, um, providers at disability agencies don't have the experience on how to help refugees. So you are kind of fill in the gap and you don't know who to ask for. There needs to be a really big shift in refugee agencies to make sure that they are providing effective services for refugees with disabilities. Yes, most definitely. I mean, I remember when I first came here, um, I tried to I applied to many jobs, and but unfortunately I got denied um, many jobs that I could have, like I was able to do, but because like people, you know, like got to know, oh, I have physical disabilities and my language skill is not good, and they are like, okay, we will not give you that chance. But they did not give me the opportunity to prove that I'm like, okay, you know, I can do. Yes, I am involved with many refugee agencies throughout the US because of my work. But I am constantly involved with the AUCD, Association of University Center on Disabilities. I like to write, you know, blogs there. I attend conferences. So in my opinion, they are really important organization in the US to help, you know, bring awareness about disabilities in general.